Rehabilitation Nutrition in Comic Book. From Can't to Can with Rehabilitation Nutrition.
Hello, I am Dr. Wakabayashi. Let me introduce a case of an 87-year-old man who had a cerebral infarction.
When he woke up, he noticed difficulty moving his right limbs and speaking, and called an ambulance.
The MRI results showed a cerebral infarction in the left corona radiata, so let's have him admitted to the SCU, stroke care unit.
And I suspect sarcopenia.
Certainly.
I don't know what his usual body weight is, but I think he used to be around 55 kilograms. He's always been a skinny man, but lately his clothes seem to have gotten even looser. He was able to do most of the activities of daily living by himself, but he didn't go out much anymore.
Thank you very much. Our pharmacist and registered dietitian will interview you in continuation. Here are Mr. Aoki's test results. I'd say he has sarcopenia.
There are things that should be done in parallel with the treatment of cerebral infarction. Rehabilitation nutrition.
Yes.
What is Mr. Aoki's nutritional intake?
Infusion is 1,500 milliliters, 382 kilocalories.
It is about half of a 1,400 kilocalorie meal he's eating without choking. He seems to have lost his physical fitness and appetite since he had summer fatigue 3 or 4 months ago. First of all, I will adjust his diet to include nutritional supplements and amino acid infusion so that he can consume 1,300 kilocalories by multiplying his basal metabolism by the activity factor as 1.2.
You may also want to consider half meal.
Mr. Aoki, how are you doing? From today on, please eat half meal and this one as well. This will give you enough energy intake.
I think I can drink this with ease. After all, I'm having trouble fitting my dentures.
Then have your visiting dentist adjust your dentures as soon as possible. Rehabilitation Nutrition Assessment of Mr. Aoki. He started training in the gymnasium, and his energy consumption is increasing. The increased load of rehabilitation may further worsen malnutrition. I need to talk to him about good nutrition intake.
Sarcopenia. I've never heard of it before.
Your husband has low muscle mass and weak muscle strength, a condition called sarcopenia. His nutrition status is also poor. Even if he does functional training in this state, it's often difficult for him to improve enough.
I thought I didn't need to eat so much because I'm old. I wanted to go home as soon as possible, so I thought I'd do my best in rehabilitation, but rehabilitation alone isn't enough.
That's right. It's important to do rehabilitation while maintaining good nutrition intake.
Eating is also a part of rehabilitation. I'll do my best to eat all the food.
I need to strengthen his nutrition intake as well as his rehabilitation. In the acute phase, sarcopenia and nutritional status are likely to deteriorate. Therefore, early detection and early intervention are essential. After 2 weeks in the hospital, he was transferred to a rehabilitation hospital. Keep up the good work. 6 months have passed since he was discharged from the hospital.
It's been a while.
Mr. Aoki, you look great. You've plumped up a bit.
Thanks to your help, I was able to go home safely. I've gained about 4 kilograms in body weight.
I'm glad to hear that.
I also attend gymnastics classes at the Senior Citizens Association. Now I can walk faster than before I was hospitalized.
That's good.
In this way, Mr. Aoki was able to live a better life than before his hospitalization through Rehabilitation Nutrition.
I would like to introduce 2 activities of Nishinomiya Kyoritsu Neurosurgical Hospital. The first is the Nst Conference. The following is a summary of the 3 nursing perspectives in conferences: activity, excretion, and nutrition. Another activity is the Sarcopenia Committee. The committee was established in 2020 in recognition of the need to address sarcopenia throughout the hospital.
Increasing awareness and connecting. Leveraging strengths. It's a team approach to rehabilitation nutrition. From can't to can. Let's change tomorrow with Rehabilitation Nutrition.